Hello, everyone, and welcome to Painless Universal, a conversation with myself and Welsh. Today, we'll be talking about all things sexual pain. I'm really delighted to have Dr. Naomi Sutton here with me today. She is so bold, and you must know her from the Channel 4 Sex Clinic. And she talks about everything sex pain. I really wanted to talk to her because one thing about Painless Universal, we just don't talk chronic illness pain. We talk about pain, and issues around pain. Sexual pain is a very sensitive subject for many. Women, including men, feel very shy to go out and talk about it, even to see their doctors. Naomi will be discussing this critical subjects. First and foremost, let me give you a little bit of introduction for you, those of you who don't know who Naomi Sutton is. Dr. Naomi Sutton is a consultant physician. She's a public advocate specializing in issues around HIV, contraception, and all things sexual health. She wants to reassure women there's nothing too embarrassing to consult your doctor or nurse about. Passionate about raising the awareness of the subject of sexual pain, with the aim of helping people feel more comfortable with their bodies, their sexual life, and reduce the stigma. She works at the Rotterdam Hospital and is also the E4 doctor on the TV series, The Sex Clinic. Well, everyone, join me in meeting Dr. Naomi Sutton. Hello, everyone, and welcome to Painless Universal, a conversation with myself and Welsh. As I previously said in the introduction, I've got Dr. Naomi Sutton here with us. And we're here to talk about all things sexual pain. But before we get into that, I need everyone to get to know who is Dr. Naomi Sutton. We've seen you all. If you've seen Channel 4 series, the sex clinic, is really amazing. I've seen all of the episode because I think it's really deep. You guys really go deep into it, into the different issues surrounding sex, and you're not ashamed about talking about this difficult, crucial subject. And before we get into all of that, Dr. Naomi Sutton, who are you? And thank you so much for joining me as well.
No, it's absolutely my pleasure. So I'm a sexual health consultant, and so I work in Rotherham. Trained in Sheffield, and I'm a mother, I'm a wife, I'm a woman, I have a vagina, I have sex. So I could, I absolutely love what I do. I feel if you cut me in half, I'd be like a piece of rock saying sexual health through it. So absolutely, passionate about what I do, which hopefully will come across today when we're chatting.
I watched the program. I remember the first time seeing it on E4, and I thought, and Channel 4 as well. And I thought to myself, why are they so open about this critical subject? What led you on that path to think, I'm comfortable, I'm just going to go out there and just start talking about it?
Well, obviously that's my job. So as a doctor, people ask me all the time, does it not affect you looking at genitals all day? I think as a doctor, you either look at bums or phlegm or sick or something. So for me, it's not the area I'm looking at. It's the fact that it's all to do with people, how people tick. I know when I applied to do medicine as a 18-year-old, I said I want to help people. And I really think in my speciality, you can. It's a really positive speciality. So there's nothing in sexual health that we can't manage or make better. Literally nothing. So we might not be able to make everything perfect, but we can manage everything. And hopefully, I hope people are scared, and people don't want to talk about sex. There's a lot of reasons behind that, but hopefully when people, after they've had a chat, they leave feeling happier. That would be my aim.
And honestly, I really think that's not just your aim, it's also my aim as well, because one of the things in this universal is that we want to talk about all kinds of pain. And when I thought about this subject, I thought sexual pain is a crucial thing, because whether we like it or not, most people, I think almost everyone tend to have sex, or they tend to have sexual pain in one way or the other.
Yeah.
And it's not knowing what to do because you're too shy or too scared to go to someone to talk about that. When you think sexual pain or any kind of pain regarding sex, how do you encourage people to get that courage to come out to you, our doctor, and say to you, I'm having this trouble and I want to talk? What would be your first advice to someone to give them that words of encouragement?
So first of all, one, doctors are used to talking about this sort of thing. So although you might feel embarrassed, please don't, because, I know it's different being a GP because I expect people to come in and talk about sex. That's what I do all day. But, we're a good port of call. But your GP, will have discussed all these issues. So I think it's about you feeling comfortable and using the right terminology. I also find what I did want to talk about a little bit was pain and sex. I think we box sex a lot of the time in a heteronormative way. So it's a penis into a vagina. Yeah. And for a lot of people, that's not what sex is. So obviously for men who have sex with men, or for women who have sex with women, or, for lots of people who have painful sex issues, I think there's a lot of pressure to have penetrative sex. And I think that's also where we get it wrong, because that doesn't have to happen. So intimacy and sex can be through a lot of different things. So 80% of women can't actually orgasm from penetrative sex. They need clitoral stimulation. So actually, if people understood that a bit more, and we were talking about that more, and learning other ways to pleasure each other, I think a lot of pain issues, especially that women have, would be managed better. So I know you wanted to ask about pain and sex and what causes it. I think so first of all, the majority of pain issues I see are in women. So I'm going to talk mainly about that, but that's not excluding men. But in women, so in all medicine, we split pain into acute or chronic. So acute pain, we'd sort of say for less than 3 months. Chronic pain is something that goes on for much longer and can last a lifetime. Acute pain could be through a bit of candida, for example, making your vulva sore, or trichomoniasis is a STI, might make your vagina inflamed. You might have pelvic inflammatory disease. You might have an ovarian cyst. You might have anything that's sort of acute but can be sorted out quite quickly. Or you could have something that is potentially more chronic, so endometriosis, for example, or post-cancer treatment, radiotherapy, things like that. Chronic skin conditions, lichen sclerosis, the menopause, that's another big one. And again, death and menopause and sex are the three things we don't talk about well enough. But half of the population will go through the menopause if they get old enough. And all these things can be helped and sorted, but again, we need to be talking about them. So first of all, we need to get a diagnosis of what it is, and then we need to either treat it or manage it. And I think sometimes, especially in Western medicine, we want a pill to be given or some quick fix, sort it out. And I think it's very frustrating. It's frustrating for me as a doctor, because we weren't taught a lot about managing chronic illness necessarily. I want to be able to say, there you go, do that and it will be better. But a lot of the time there is no fix. And I think that's where your YouTube channel comes into its own, is it's managing those, I guess, expectations of life and those chronic conditions. So for example, if you do have endometriosis, for example, which is a very common problem, you might have pain, deep pain. And so although you can manage the endometriosis in a lot of women, sometimes there's scarring, for example, which then causes chronic pain, which you can't necessarily do anything about. And there's lots of things that we just can't get rid of. So again, it's about managing that. I'm getting a bit lost now. I'm getting overexcited and going in different ways.
No, but it's really making sense on my end, listening to
okay. Good.
These are kind of pains that we just don't talk about, and it's how to manage it. But that's where you're getting to, because I really want to understand how do you manage it. And I'm not talking about the quick fix method, which you just said. It's not just about taking pills. But how can we women, who really experience pains like this, how can we manage pains of this nature?
So first of all, get a diagnosis. Try and understand what's going on, because I think it is really important, if you do have endometriosis, to have medical treatment. But then it's managing the pain that's alongside that I don't think the NHS does particularly well. There are, well, basic things. So if it is, so first of all, don't have penetrative sex if it hurts. You don't have to. Clitoral stimulation, self-masturbation, all these other things. Talk, if you are in a male-female partnership, talk to your partner, explain what's painful. Certain positions can help. So sometimes if a woman's on top, she can manage the depth of penetration if it's a deep pain issue. I've got a couple of little tools that I want to show you about if it's deep penetration that hurts. One is this. I'm not sponsored by these, by the way. So it's O-Nut. So it's basically a little, they're rubber rings that, here's my penis. I know, I'm ready. I'm prepared. Basically, so if depth is an issue, or your partner's very big, you can basically, I should have some lube. That's another thing. Lube. I think we're all embarrassed about lube. So again, another myth is that women, if they're excited, are wet.
Yes.
Well, some women don't produce a lot of lube, for want of a better word. But it doesn't mean they're not excited. And also some women will produce lubrication even when they're not excited. Do you know what I mean? So, but don't be embarrassed about needing lube, and especially with menopausal women, lubrication dies off because you lose your estrogen. So lube, I think, should be part of regular sex. I don't think there should be any embarrassment at all. Anyway, I'm just going to lube up my willy.
Yeah.
You're loving this, aren't you, Anne?
This is just fantastic.
So on it goes, and there's 4 of these.
Okay.
And it's basically a bit like a rubber ring, I suppose. But it just stops. You could use 1 or 2, 3, 4, but it stops the depth of penetration. So it's comfortable for the man because he feels like he's having full penetration, and it's less scary. And I'm sure there are other. Oops.
Oh my goodness, I've never heard of this. Never seen it in my. Never.
I know, and I didn't get taught this at medical school, which is why I think it's these little things that are really important to talk about. So that's called the O-Nut. And then there's this other exciting little product by Come Closer, and it has a little bullet vibrator in the end. Oh shit, if I can get it out. I've got all lubed up now. Anyway, so that goes on. So you can turn that on, give you a bit of excitement. And then this again it's the same principle. You're basically producing a buffer, but with the vibrating bit that can give you a bit of extra clitoral stimulation.
For the guy, at least for the guy, for him to feel.
Or for the woman. So this is vibrating. So if they're having sex in missionary, this is sort of vibrating around on the clitoral stimulation. So there are products out there. So that's Come Closer and O-Nut. So lube, try products, try different positions. The other thing I would say is a lot of people haven't heard of a condition called vaginismus. Have you heard of that?
No.
So if people have pain, it can happen for lots of reasons, but a lot of people, if they're frightened of sex, or they've had sexual abuse in the past, or something's happened which has made their body, I guess, scared of sex, or it just happens, or post-birth, lots of reasons. The pelvic floor, so the entrance to the vagina can clamp down. So basically it makes it very, very difficult for entry of the penis. So, and it can be of varying degrees. But what women will most common complain of, because I was talking about deep pain then with kind of sort of endometriosis or adhesions, things like that. That's deep pain. Okay. If it's pain on entrance to the vagina, kind of a stinging pain, it's just worth thinking, is this vaginismus? And I think a lot of the time, people will go to the GP and go, my partner finds it difficult to penetrate me, or I find it very painful, and they'll say, just relax, love, have some lube. And actually that's not the answer. So if you do have vaginismus, you have to understand what it is. So basically it's almost like an involuntary reaction. So you may be really ready for sex, but your body is saying no. So it's either because of previous trauma or because of previous pain, or it's just happened. Sometimes we never really find a reason. And again, it can be due to sort of guilt and stigma and, you know, religious reasons. You feel sex is wrong. So even though mentally part of you feels ready, your body's going, oh, and it sort of clamps down. So sometimes people can't insert even a little finger into the vagina. So difficulty putting tampons in, for example, maybe in the history. And some people can still accept a penis, but it might be very painful. So it gets, and I guess to know you've got that is to put 2 fingers at the entrance of your vagina, and if it feels very tight, and sort of, I guess it's difficult because I feel lots of vaginas, so I know what's normal. But anyway, that is potentially a cause that I don't want to miss out of this pain discussion, and I think gets misdiagnosed, and I don't think women necessarily understand what's going on. So you can self-help, so there's dilators and things like that, but the biggest thing for any of these sort of conditions is psychological help, I think. So if it's causing problems in your relationship, whatever pain it is, get some help. So therapy, I think, I mean, I believe everybody needs therapy for one reason or another. I don't think you can ever go wrong with a bit of therapy.
Exactly. Talking to someone helps, absolutely.
Yeah. So talk to your friends or talk to someone who's qualified and, you know, understands the problem. And, you know, talk to your partner. It's all communication. And, you know, but all these, again, this can be managed, but so 1, you need to get a diagnosis. 2, you need to think, do I need further help? And 3, you know, investigate, Google. I mean, Dr. Google isn't always brilliant. So talk to a professional. But there are loads of self-help groups. So if you get the right diagnosis, there are lots of ways that you can help yourself.
But Dr. Naomi, honestly, I would like to bring in, why does society really struggle with the subjects, sexual pain?
Oh, wow. I think we have to go back to how we've developed as a society. So, first of all, there's this concept of virginity, no sex before marriage, monogamy. All these things are very societal because it's sort of the patriarchy and ownership of women, and there's loads and loads of other issues. And I think historically, parents don't talk to children about sex. And I think there's a lot of, I know I'm talking a lot about women at the moment, but there's a lot of shaming of women. So I think women feel they're not allowed to be sexual. Or I remember at school, if you look on the back of a toilet door, there was lots of penises drawn everywhere. No one ever graffitied a vulva because it's not something almost to be proud of. Or, you know, what do you call your vulva? You know, it used to be called a tuppence or a, I don't, you know, people struggle about that. Whereas men are like, me willy. And obviously, you know, men have sexual problems as well, and pain, and men can be sexually assaulted. And, you know, so I'm not, but in general, I think women are boxed a little bit differently in regards to sex.
Because I noticed that, especially in society, and you know, it depends on your race, your religion, where it really it's not a subject that comes so easily for parents to talk about. I know from my background, it's not a subject for my mother to even talk about. I think it's just like, let's delete that subject and you figure it out as you go along. And you know, it's very difficult because what if you run into problems along the line and then you're not quite sure how to solve that problem?
Yeah, and I think as well, there's a lot of misconceptions that, you know, I think parents are worried that if they then open that box, one, they don't know quite how to answer the questions, but also I think sometimes they feel if I talk about sex, they're going to go out and have loads of sex. I'm going to open this box. And if you look at sort of Sweden and places that have better sex education, they have a much lower rates of teenage pregnancy. So I would encourage and I mean, I've got 2 children. Don't make it into a chat. Have the chat all the time, like you talk about food and exercise and work. You know, just bring it into everyday conversations, and then your children won't find it a difficult subject. So my daughter knows that her private areas, for want of a better word, a cord, a vulva, the vagina is the tube. I've got a son who, you know, hopefully will get all the prizes in his sex ed. He knows testicles, and, you know, we've discussed what a condom is, and I mean, he's 11, my daughter's just turned 9. But again, through their whole upbringing, if they've brought up a question, I've tried to answer it as well as I can in their language.
Yes.
And so it's sometimes I do it dreadfully wrong. For example, my son about a couple of years ago said, "Mummy, what's a condom?" And I was like, "Oh, where did you hear that?" And he said, "You." I was like, "Oh." So I said, "Oh, it's a bit like a plastic bag that goes on the end of a penis and collects the seeds." and then he looked at me horrified and said, "What, I shoot seeds out of my penis?" And I think he was thinking like apple pips. Anyway, so we can all get it wrong, but have a, you know, giggle about it, and I think examine why you're embarrassed. Like, actually, what, you know, is there any reason to be embarrassed about it? And I think, again, I was brought up in a family that didn't talk openly about sex, and you know, I remember my mum had the chat about periods or something when I was about 13. I think I'd already started them. You know, it felt awful and embarrassed because it was such a big deal. But I think if you feel embarrassed, think about why you're feeling embarrassed, and is that right? Because often it is a cultural thing or a societal thing. You know, there are bodies. We should be talking about, you know, and I want my son and daughter to have a good sex life. I want them to be able to talk to me, and, well, maybe not talk to me, but, you know, I want them to be able to talk to their partners, or, you know, if they do have a problem, fine, talk to me or talk to someone else, or have the vocab and the understanding to be able to do that.
I see you on a mission to reduce.
I am on a mission.
Yeah, and you're also on a mission to reduce this stigma surrounding sexual. What led you on that path? I mean, is it because of what you saw at hospital, being a doctor, you realized, or is it just because? What led you on that path to say, okay, I'm definitely on this mission to do this?
I guess so. I do HIV clinics as well, and I think that's the most stigmatized sexually transmitted infection there is. And I guess I'll be sitting there, and someone will be crying and telling me that they can't tell anybody in the world about their diagnosis, and that hurts. That makes me so frustrated and angry. And, you know, I always, if, for example, you're diagnosed with breast cancer, you'd go home and you'd tell your loved ones, and they'd all go, "That's dreadful, that's, you know, poor you." If you get diagnosed with HIV, often people don't tell a soul, because if they do go home, people go, "How did you get that?" And it's almost like a blame thing. Does that make sense? You know, because people are I get it.
It does. It makes sense. I get that.
Yeah.
It's not something. Yeah, go on.
Sorry, I mean, people are nosy. I'm nosy. I think that's why I love my job. But again, that person has to live with that diagnosis and cope with that stigma and tell sexual partners. Although, well, I should pop in, given that it's vaguely educational. People now who have HIV, who are treated, so on antiretroviral medication, with an undetectable viral load, can't pass the virus on to sexual partners. So actually, people with HIV who are well controlled are, I guess in better sense of the word, safer. I don't like that word, but safer to have sex with, in they're less likely to transmit HIV than someone who doesn't know their status. Because if you don't know your status, you don't know that you've got the virus, and therefore you can pass it on. Does that make sense?
That makes sense. Yes.
So yeah, and there's about 7,000 people still undiagnosed with HIV in the UK. So, you know, onward transmission is still going on. And so, you know, if we could, and again, people don't want to be tested because they don't see themselves at risk. But I would say if you have sex, which is 99.9% of the adult population, I'd say, if you haven't been tested, get tested, because there's no shame in it. There's no, it's like going to the dentist. Although sometimes I feel a bit ashamed going to the dentist. Oops.
Sorry.
I eat too much chocolate. I get told off.
Yeah.
Sorry. But there shouldn't be any shame in going for a sexual health screen. I think it's a healthy thing to do, and I think we should be encouraging people to do that more.
What was the hardest thing you've ever done? I know you did the Channel 4 sexual health sexual clinic. I think for me, if I was called upon, I know this is your bread and butter. This is something you do. It's something you practice as a doctor. But to go now on national TV to start doing that diagnosis, was that one of the hardest things you've done?
It was definitely the hardest thing, especially because this social media world is completely new to me. I wasn't even on Instagram or Twitter or any of those things before the TV. And they're like, I think you need to get with the program. But again, I'm so passionate about what I do. I think I forgot almost that there was cameras in my face. And I just loved it, and I think it's been a real success in getting people to talk about things. So yeah, I think it was. And again, as a woman, I worry people are going to say, "Look at your big bum," or we're all so obsessed, aren't we, with what we look like. I was worried about being trolled, and but actually, people have been lovely, and I've had nothing negative. So I know I'm very lucky in that sense. I think there was enough people to troll on that with the poor patients who I think got a hard rap sometimes. But yeah, it was hard. I would say the hardest thing for me though is having children, without a doubt. There's no guidelines for having children. There's guidelines for what I do, so I can look them up on the internet. But children, it's the dynamic between all those relationships and juggling work and social media and the job and their happiness and football trips. And so I think for all human beings, I think it's the hardest thing we do is relationships in all aspects of life.
Yeah, no, I feel you on that. I have 2 children as well. So my son is 11, my daughter is 3, and managing that and managing their relationship, managing who they are, there's just no manual. You just have to, especially now that he's doing his 11 plus, you just have to breathe in and
I
breathe
would say for any parents struggling to talk to their children and understand how to open up those conversations, there's a really great group called Outspoken Sex Ed, and they have a newsletter that you can sign up to for free, and they send it out every month. And they've got lots of advice and blogs and things on their website, but it's a very good, every month they send you something, and it's just good to, I guess, keep on top of what's going on, because it'll be about cyber sex or sexting or I don't know, LGBT issues, whatever. And I think it just expands parents' knowledge, because I think it is a frightening subject. And I think children now ask much maybe more difficult questions than when I was younger. So yeah, I think it's very daunting. So I think as a parent, have a look at that Outspoken Sex Ed. I think they're a great little group that are trying to get parents talking. And again, don't rely on sex ed at school, because it's so variable. And again, the parents might be embarrassed or whatever, and they're your children, and you know them better. You know when to answer their questions, because children develop at different rates, don't they? And they'll want information at different times, and they might not want it in that lesson. They might want you to chat about it. And
no, that's really helpful, because that's something I've not even I've not even thought about how do I start that conversation. I'm like, how do I start? Please don't ask me that difficult question. I'm not ready. But eventually you have to start. You have to start.
And also, it's never too late. And if they do ask you something that you're unsure about or embarrassed, just say, "Can you give mummy a bit to look that up first?" So don't plow in. I think what's really important, so part of why we're so shamed about talking about sex is because it's a taboo subject. So I think if we, as parents, if our children come to us and go, "Mummy, what's a condom?" or whatever they've asked, if you sort of go, oh, why are you asking that? Instantly, they shut down because they then see it as something wrong and taboo. And so you're creating the same cycle that we're in as an older generation. So I think if you go, okay, interesting question. Not quite sure how to explain that to you at the moment. Can you give me half a day and I'll come back to you, or whatever? Does that make sense? So just try and not be aghast. Or, you know, if they say, I mean, obviously it depends what age people are, but, well, ask about anything. If it shocks you, try and hide it, and then go, mummy just needs to do a bit of research, and then we'll have a chat about it. There's loads of great resources out there to help as well. So don't feel you have to do it all alone.
No, that's absolutely true, because I think that's immediate reaction of you saying, I know someone like my son would absolutely shut up. You know, he would not come back to me again asking that question, because he would just, that reaction would stay with him for a very long time. So I love that you highlighted that point, because it's something I see in kids, and I know you have to know your kids, and you have to know what makes them really, that would be like, I'm very embarrassed about that. I better never ask that question again. You know, it comes to a final question, and in society, we still deal with lots of pain, we still do lots of shyness about the issue of sexual pain. What would be your hope for, you know, you've been doing this for many years now, and you've seen all our challenges, and you know where the difficulty lies and what society needs to embrace. What would be your hope for the future?
Again, more things like this, educational things that help people. And I think it's some people like watching things, other people like reading things. I just think the more accurate, friendly, open chats can only ever help. And I don't know if you did say shame, but shame is a big issue that comes from, I think, sometimes lack of education, but also cultural, etc. So I'd love to see the I guess shame being got rid of, shame, stigma. You know, I want that not to be involved in sex. It's a joy. It's a joyful thing. We all do it because it's fun, and it's intimate, and it's bonding, and you know, there's so many benefits to sex. We should be, I think, just talking, just talk. Shout about vulvas, vaginas, penis, whatever. Like, you know, let's say the words and not say them with any kind of strange, shameful feelings. But again, I think we all need to work on our own inner shame, find some inner peace, inner joy. I'm loving the word joy today.
I love it. It's sort of my slogan: living with pain and finding joy.
Exactly. And that's what I would love to happen. I'd love people to have really great sex lives that are joyful and pleasurable. You know, sex should be about pleasure, and you know, but yes, there will always be pain involved in it, but there are ways to manage that, I think, hopefully.
Thank you so much, Dr. Naomi Sutton.
Oh, it's been a pleasure.
And I'm so glad, you know, you took the time out of your busy schedule to talk to me. I really appreciate it. Thank you so much.
Pleasure. It's been lovely to meet you.
You too.
Bye.